report that is coming out later today, and that is the interim report from the Aged Care Royal Commission. Joining us live now is the Shadow Minister for Ageing and Seniors, Julie Collins from Hobart. Julie, thank you for your time. What can we expect to come out of this report later today?
Well, what we're hoping with this report today is that it shows a pathway of action for the government. What we can't afford to do, of course, is to wait till the end of next year when the final report on the Royal Commission, from the Royal Commission, is due. We need the government to act as soon as possible as it gets this report today. We have too many older Australians in the aged care system today, their families and their loved ones, that need this government to act, and act quickly. We expect that there'll be things in there around workforce. We expect that there'll be things in there about access to home care. We expect that there'll be things in there about more transparency needed in the system.
Now, the report itself, or the background papers, for the Aged Care Royal Commission have acknowledged that there's been over 20 different inquiries of different types from previous governments, both Labor and Liberal, into the aged care sector. Why hasn't action been taken already?
Well, that's a good question. As we know, we've had 6 years of this government. We've had 4 ministers. We've seen billions of dollars ripped out of residential aged care. And what we need is for the government to act. All of the recommendations currently sitting on its desk, it also needs to implement, or say it's not going to implement, and why. When you've got so many reports sitting on various ministers' desks that have been there in some cases for years and not been implemented, it's simply not good enough. What we need is for this interim report from the Royal Commission today to be an impetus for action. We need the government to act, and we need the government to act now.
The thing is, with the Aged Care Royal Commission, it hasn't received much coverage. It has been exposing some truly awful stories about the treatment of elder Australians in treatment, but it hasn't really had any kind of dramatic social effect. Why do you think that is?
Well, I think that what we see is some people think that just because people are getting older that, that they should receive a less standard of care. I heard some terrible stories in Western Australia, in Perth yesterday, of people that went into an accident emergency that were treated differently to a young person with a broken bone. Now, that shouldn't be happening. We need all Australians to be treated equally. During the estimates last week, we had one of the government senators, when we talked about the number of people that died while waiting for home care being more than 16,000, we had one of them say, well, what was the age of them? Well, yes, when people do age, we do expect that people die, but you don't expect 16,000 out of a waiting list of 120 to die in 1 year waiting for care that they should have got that they didn't. It's simply not good enough for people to try and pretend that we shouldn't be improving the system. As the population ages, as more and more Australians are hitting the system, as more families are coming into contact with the system, we're seeing people understand that this system needs massive reform, and it needs it today, and the government can't wait any longer.
The big discussion that has come out of it has been around physical and chemical restraints, the fact that dementia patients can be given sedatives to make them completely incapable of doing anything just for the benefit of their carers, and that families don't even necessarily need to be asked, just notified. What are you proposing should change in that space?
Well, the government's had new regulations in. It's the first time we've had the government regulate chemical and physical restraint from the 1st of July. I've raised my concerns with the Minister that what this does is it simply registers the amount of chemical and physical restraint that's occurring in facilities. What I'd like to see is for the government to review that in 12 months and to strengthen those regulations so that we do have proper informed consent of the individual or their loved ones or relatives, whatever is appropriate in the circumstances. But what we need to do is have a system that encourages re-ablement, that encourages improvement in quality of life. Just because people are old does not mean that their quality of life cannot be improved. And what we need is a funding system and an aged care system that responds to improving quality of life for everybody that's accessing the services.
Now, if we turn to comments made by your parliamentary colleague Claire O'Neill, she's spoken about what she thinks contributed to Labor's loss, including the fact that progressives in the party were often talking down to their traditional support base. Do you agree with that?
Well, I think everybody's got their views on what happened during the last federal election campaign. I think the important thing that Claire's trying to get across here is that we need to listen to the community. We need to get out and about more. We need to talk to more people in the community about Labor values and why people need to vote Labor at the next election. When you look at the current government and you look at what they are not doing, when you look at things like aged care, where we've had 6 years, 4 ministers and billions of dollars ripped out, we need to explain to people that we will do it better and how we'll do it better, and we need to do that, and we've got 3 years nearly to do that, and I'm sure we're capable of it.
So Claire O'Neil said that progressives are too quick to dismiss people with opposing views as obviously wrong, probably stupid and possibly subhuman. Do you agree?
I think what she's saying there is we need to respect everybody's views and we need to talk to the community, and that's what we're all doing. And certainly we have a review into what happened at the last election, and that'll be out in coming weeks, and we need to respond to that.
What do you think went wrong for Labor at the election?
I'm not going to preempt the review, Annalise. I'm happy to, post the review, talk to people, but essentially we need to get out and about. We need to talk to the Australian community, and that's what we've been doing post-election and what we'll continue to do right up until the next election.
Do you think Claire O'Neil then is preempting the review? Is this unhelpful?
Well, I think she's just stating the obvious, that we need to get out and we need to talk to the community.
And that might have helped you at the election?
Well, we all have different views about what did or didn't happen during the election campaign and prior to that period, and the review I think will clarify some of that.
And if we just go back to your shadow portfolio, what's your number one priority for aged care in your shadow portfolio?
Well, I think we need to keep pressure on the government to respond to the various reports, recommendations, and to the Royal Commission interim report that's due today. There are things the government that knows are wrong that it should be acting on today. Things like the home care wait list, things like workforce and dealing with the lack of workforce in aged care, things like more transparency. There is so much that the government could do today and should do today, and I'm encouraging the government to act very quickly.